In those days, solo practitioners, we would depend on your buddies to take care of your patients while you were on vacation or gone or something.
And I'd always had a hankering for a group practice. It had never been done before, so this was being creative. And so we decided that we wanted to work together. The gist of it was, when you get into group practice, you share overhead, you share other things, and you'll have more time off. We used to laugh because it sure wasn't any of them. I'll tell you that. Oh my, is this ever nice?
This is our original location.
Second building, the first one was torn down after 30 years. This was the test site to really change tradition. It was pretty lonely at times. And yes, people did say, "What the hell are you doing?"
Because a group practice doesn't stay a group practice if there's a lot of things that aren't being handled properly, meaning personalities, clashes, and that kind of thing. Has to be at the minimum in order to feel that you're making headway.
We wanted to develop guidelines for each procedure we did. So we worked together on it, and we got these care guidelines going, accountability guides they were called. And we were the second in the country that went through accreditation. That was brand new.
They would come into the office and you passed the tests, verified that indeed you were at a higher level.
Never did I have a vision of 1/10 of what it is now. The vision was to make this successful.
We never talked in the sense we want to get 3 more offices in the next 2 months. It grew naturally, and the folks were gathered together to make it bigger, certainly. I think that's one of the most satisfying accomplishments, gathering the people that can make it work.
It's not just the doctors, not just the owners. It means the people at all levels. The dental assistant that work part-time, full-time, the people in sterilization, the lab people. You have to pick the right people that get it, where their mind speaks through their heart.
Fulfilling what a person, patients need, it's very satisfying.
We never would have been able to sustain all the efforts we had without Don and Jeanette.
Sure.
I said that before he would say it.
Certainly one thing would be not to look on your career as a job, but also get involved in the dental profession that'll be available to you to expand your talents and help these other folks as they come into the scene.
But this is where you do your work, right here. If we're going to maintain our status as a profession, we have to be sure we have the academic side, but it has to be integrated into the compassion for people, because you can lose it along the way if you sort of forget that. Getting standards and systems in place, that gave the foundation for what Park Dental is today. I didn't do it. Not one person did it. A whole group of people did it. And this is just beautiful.
Yeah.
Beautiful.
It's in good hands.
That's right. Job well done.